Hi, Dr. Peterson here with today's COVID update. Today is Tuesday, April 28th, 2020. Information presented is current as of today and may not be current tomorrow. We keep an up-to-date list of resources which are time-stamped so that you can be sure that you're getting the most current reviewed information that we have available to us. Go to regionsems.com and click on the COVID link for those resources. Obviously, I'm working today, coming at you from Lakeview Hospital in Stillwater, Minnesota, as I'm sure many of you are working today as well. Numbers-wise, over the weekend now, we have increased quite significantly. Worldwide, we're at just over 3 million confirmed cases with about 212,000 confirmed deaths. In the United States, we're almost at 1 million confirmed cases, with just about 56,000 deaths attributed to COVID-19. Minnesota took quite a jump over the weekend. We're at 3,800 confirmed cases with 286 deaths. And in Wisconsin, just over 6,000 confirmed cases with only 281 deaths. So even though Minnesota has been tracking at about half the numbers that Wisconsin has been, over the weekend now we've seen a jump in our deaths here in Minnesota, and we have now surpassed Wisconsin as far as COVID-related deaths. So I don't know if that means we're on the verge of a surge here or what's going to happen. I guess we'll find out in the coming weeks, but I guess just something to keep our eyes on, especially as the economy starts to reopen gradually. A few things to talk about today. Got some questions over the weekend about the 14-day mandatory quarantine for people with a high-risk exposure. Are there options for testing that might limit the duration of quarantine? So let's say after a week you haven't developed any symptoms. Could you get tested, maybe even with an antibody test, and come back to work early? Short answer is no. The long answer is that we have to differentiate between people who have symptoms, who have been exposed and now are developing symptoms, versus people who have been exposed but haven't developed symptoms. If you have developed symptoms, then obviously you need to isolate whether or not you get tested. If you do get tested, then you can return after a series of negative tests. If you don't get tested, then you have to wait at least a week, and then you still have to be symptom-free for at least 3 days before you can come back. So the soonest you could come back is a week after developing symptoms, assuming you only had symptoms for a couple days, and then you had 3 days of feeling good, and then the week expired, then you could return to work. However, if you have a high-risk exposure and you haven't developed symptoms, there's nothing you can do except sit out for 14 days. It can take that long to develop enough virus particles in your throat to test positive, so we can't rely on a negative test before that 14-day period. And the newer antibody tests that are available are not accurate until you've had symptoms for 14 days. So they're not even appropriate for testing asymptomatic people in the acute early phase. It's helpful to see if you've been exposed at some point previously, but if you do test positive, it was likely more than 2 weeks ago. So we still can't even use those tests within that 2-week window. The best thing that you can do, though, to prevent yourself from having a high-risk exposure is to wear a mask at all times. Every patient encounter, in the station, in the ambulance, in the fire truck, in your police car, everywhere, unless you're just in your private bedroom at your quarters or in the bathroom or something like that. But any place that you're around other people, wear a mask at all times when you're on duty. If you're wearing a mask, then you cannot, with our algorithm, have a high-risk exposure. The highest you would get is medium risk, which means that that's the one thing you can do to reduce your risk of getting a forced vacation for 14 days. And I'm sure your colleagues would appreciate you not being out for 14 days, so let's just all wear masks and just make this pretty simple. One big topic that has come up, at least at Regions Hospital over the weekend, is what are we doing about patients in what we call congregate living situations? Congregate living just means group living. So that could be anything from a jail, prison, to a residential group home, to a nursing home, or even an assisted living facility. There is such a widespread outbreak of COVID in these facilities, and you get one infected person and it just spreads rampant through those facilities because they're in such close contact. This has been coming out of every single state, and now we're seeing it here too. To the point now where we really need to consider every patient that comes out of a congregate living facility to be suspected COVID positive until proven otherwise, regardless of why they need to go to the hospital. So if somebody trips and falls and breaks a hip, even if they're otherwise healthy and have no symptoms, for now, we probably need to treat that patient as if they have COVID and wear the full contact respiratory droplet PPE, because we are seeing a high number of asymptomatic patients from these types of facilities that are testing positive for COVID when we admit them to the hospital for other reasons. So we're going to be treating them a little bit differently than others out in the community, and I think that needs to extend to EMS as well. So our recommendation for now is that anytime you take a patient out of a group home, a jail, a prison, assisted living, nursing home, anything that we might label a congregate living facility, you need to pretend that they might have COVID infection and use the appropriate PPE that's recommended by the CDC that we have posted on our website. So that's going to be the biggest change for now, at least until we have better access to testing in these sites, so we know where where the virus is spreading in each of these facilities. So for now, we just need to treat everyone at those facilities as if they're positive until we know better. Okay, and then just a reminder too, documents on our website that talk about testing availability for first responders and even your family members. If you become symptomatic or your family members become symptomatic, you can call the Health Partners Nurse Triage line, identify yourself as a first responder or a family member of a first responder, and they'll walk you through the algorithm and help coordinate your testing if it's appropriate. As always, any questions, send to our office, regionsems@healthpartners.com. We're here for you. We'll do whatever we can to advocate on your behalf, to answer any questions you might have, and hopefully be responsive. So don't be afraid to reach out. I know many of you have been reaching out, and we are here. So please, any questions, send them our way. Okay, let's go back to last Thursday's trivia question. The question was, who was not cited by the Federal Trade Commission, the FDA, or by state authorities for peddling bogus COVID-19 treatments? And the correct answer was B, radio star Rush Limbaugh. Rush Limbaugh has not been cited by any of those organizations for peddling bogus treatments, whereas the other two options, televangelist Jim Baker and InfoWars host Alex Jones, have both been cited for that. So shout out to Tom Ballas from Stillwater Fire and Matt Lundquist, Lunny from Lakeview EMS for guessing correctly. Congratulations, guys. Today's trivia question, which we'll answer on Thursday. Who initially refused to suspend operations at their Nashville bar after the mayor ordered bars to close? Was it A, Blake Shelton, B, Kid Rock, C, Jason Aldean, or D, Dierks Bentley? Send your best guess to regionsems@healthpartners.com. We'll give you a shout out on Thursday. Also, check out our COVID Warrior patch board, and if you do not see your agency represented there, please send us a copy of your patch. Even if you're from outside of our area, from the Twin Cities, Western Wisconsin, we'd like to hear from you. We'd like to know where you're from and what your agency is doing with regards to COVID preparations. That's it for today. As always, be safe, be healthy, and we'll see you on Thursday.